Oke, bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh. Welcome back to the tutorial for the counseling practicum. In this topic or in this video, I will give you a little bit information to prepare counseling about the cardiovascular system. Okay, before I give you some information to prepare the counseling, here I put some key fact or some information, global information, about the cardiovascular. Okay, the first one about the cardiovascular disease. The cardiovascular disease are the leading cause of the death globally. I think you already know. Most people, if the people got some cardiovascular disease, it's will lead to the death, and then an estimated 17.9 million people died from CVD in 2019, representing 32% of all global deaths. Of this death, 85% were due to heart attack and stroke. You can imagine by yourself, But the cardiovascular disease almost 32%, in 2019. And over 3/4 of CVD deaths take place in low and middle income countries. Of course, I think it's correlate with the knowledge and also correlate with the socioeconomic. So the people cannot I think the think of the people cannot open as in the other country. Okay, out of the 17 million premature deaths, premature deaths is under the age of 70 due to non-communicable disease in 2019, and 38% were caused by CVD. So, most cardiovascular disease can be prevented by addressing behavioral risk factors such as tobacco use, unhealthy diet and obesity, physical inactivity, and harmful use of alcohol. So actually, this is one information. This is one topic that have to be informed to the patient. About dietary, and then to prevent obesity or maybe to lowering the body weight. For the people that already got some CVD. So I will talk again in the last slide. So it is important to detect the cardiovascular disease as early as possible, because if we know the disease as early as possible, we can plan some pharmacotherapy or the other non-pharmacologic therapy also. We can plan that therapy, and then hopefully that can stop the complication. Okay, here are about the cardiovascular disease. Cardiovascular disease are a group of disorder of the heart and blood vessel. So if the problem that's appearance in the heart and the blood vessel, it's called as cardiovascular disease. So here are some classification for the cardiovascular disease. Any coronary heart disease, the coronary heart disease is a disease of the blood vessel supplying the heart muscle. So the problem is in the blood vessel, which the blood vessel will supply the heart muscle. Yeah, for example, the disease that included in two coronary heart disease, any ACS, yeah, ACS acute coronary syndrome, and then the other any ischemic attack, and any myocardial infarction, as in the case, yeah, and then and the last is chronic heart disease, yeah, or chronic chronic heart failure, yeah. The heart is failed to pump the blood. And then beside focus the blood vessel that supply the heart muscle, and also the cerebrovascular disease, this focus the blood vessel that supply the brain, and then peripheral arterial disease, supply the arm and legs, and then any rheumatic heart disease, yeah, damage to heart muscle and heart valves from rheumatic fever. And then congenital heart disease, this some condition that carry out from the birth, yeah, birth defect. And then any deep vein thrombosis and pulmonary embolism. So actually, this is just classification for the example of the disease I mentioned before. Yeah. Also, the hypertension, it's included yeah, cardiovascular system. Yeah, because the problem is is in the blood vessel. So yeah, this is some information, not inform yeah, information that have to be gained, yeah, from the um, patients, yeah, or the family. Yeah, the first one is about the lifestyle. It's very important to ask, to be asked, yeah, to the patients. The lifestyle included diet, how the patient consume, yeah, food every day. Is it the patient like very apa ya, fries, like gorengan, ya, in Indonesia, ya, or maybe the other that have to be fried, and then because fried is a lot of ini oil, and then a lot of from the lipid, yeah. And then how about the tobacco use, exercise, activity, and then stress level? It is important to be asked to the patient, and of course the alcohol use. Yeah. After you gain about the lifestyle, you have to ask also about the disease history. It's very important, yeah, to be asked to the patient, because you can take some conclusion that if the patient got some cardiovascular disease, like in the case kan, the patient got STEMI, yeah, ST elevation myocardial infection. That's because of some problem in the hypertension, and then also any problem to lipid, yeah, dyslipidemia. So that's why you have to ask about the disease history, because you can take some conclusions, yeah, that the cardiovascular occurs can caused by the other disease, yeah. You have to ask, because if you know, you can yeah, make some planning, yeah, the detailed planning to make sure that all the disease will not be more severe, yeah. And then beside the disease history from the patient, you have to ask also about the family disease history. Yeah, it will help also to make some warning, yeah, to the patients, yeah, warning, and then to be careful, yeah, to prevent the severe condition. And then after that, ask also about the medication history, yeah, include adherence and also adverse effect. Medication history, yeah, correlate to the disease history, yeah. You have to ask what kind of the medication that already used by the patient, and how the patient adherence, because like in the case, you can see, mm, the patient the adherence of the patient is poor, so that's why any STEMI occur after hypertension and dyslipidemia. So that because the blood pressure is not controlled, so that can lead to the cardiovascular disease. So you have to ask about the adherence, and then you have to ask about the adverse effect that may be happen in the patient, because if the patient got some adverse effect from the medication, the patient will maybe will not adheres anymore. Yeah, like if we compare with no adverse effect, no adverse effect happen. It's really to be not adhere anymore, and then maybe from if any adverse effect occur in the patients, will make some condition more hazard, or more the quality of life more lower. This is some information that have to be gained to the patient if you do some counseling about the cardiovascular disease. And then after you got some this information, you can analyze in your brain what the next information that have to be given to the patients. So this is about the giving information. Of course, you have to explain about the disease, including complication. I mean, if the patient just got the hypertension, so you have to you have to give the detailed information what is the complication that maybe happen in the hypertension condition. So from that, hopefully the patient can do some medication or some treatment with the adherence, good adherence, I mean, and then we'll prevent the complication. If in the case the patient already got myocardial infarction, so I think it's best if you give some information to the patient about why the STEMI can occur in the patients, so it can open the patient thinking, or open the knowledge of the patients. So from that the patient will more will more adheres with or to the treatment. So for the practitioner healthcare, I think you have to you also you have to get or you have to know about the disease history, because it will correlate with the choosing of the drugs or medication. Okay, I will next to the second point about the drug information. You have to give some information about name, active ingredient, dosage, administration, adverse effect, and the storage. This is a focus to the patients. But for health worker, I think you can take some correlation. For example, in the case between the HCVD score and then the choosing of the treatment, like for example, how to choosing the lipid lowering agents, how to choose about the anticoagulant or maybe anti thrombotic or the other, yeah. So it's you have to know about it, and you have to give some explanation to the health worker why you recommend that's medication or that's drugs, yeah. And then you have also give some information for the practitioner, yeah. It's about the drug interaction, yeah. It's important because maybe the other practitioner health worker don't know about the drug interaction. And then for the patients, yeah, next give information about how to control or monitor the disease. Yeah, ask the patient to come back here to the to the doctor to see the conditions, and then give also about the lifestyle. And then maybe the patient will receive more than 2 medications, so we can call as a polypharmacy. Actually polypharmacy more than, I think more than 5, yeah, 5 included to polypharmacy. So it's can, yeah, you can give some medication card, yeah, to help the patient, yeah, to monitor yeah the treatment or the taking medications. And then to the patients, please give some motivation, yeah, give your empathy, because this disease, yeah, have to use, yeah, the medication almost over time, yeah. So I think just that. And then for the difference between the patient and then the practitioner, yeah, for the practitioner you have to focus to this one, to drug informations, yeah. And then I mean the drug information is based on, of course, based on the, yeah, evidence-based medicine, based on the guideline, and then of course based on the patient condition, yeah. Okay, just that about the tutorial counseling. Yeah, hope this tutorial can help you to prepare the counseling.